Hey, good afternoon, General Huber. It's hard to believe we've been at this Because We Care campaign for 45 days now, and our effort here is, and the campaign might be coming to a close with the videos we put out, but obviously Because We Care is something that endures throughout the organization for all time going forward. Yeah, the time has gone by for the campaign, and looking forward to what's next.
I know, sir. It's just remarkable when you think about everything that was accomplished and all these amazing resources that we have right here in North Dakota. I think often folks think that you have to, go outside North Dakota, but with all the resources that we have that help families, service members, through hard times, it's just amazing, the resources.
I know, and I've enjoyed watching all the videos, and I think it speaks volumes about our program. I mean, even during this Because We Care campaign, we got an award from the Army for our work with the Department of Human Services and removing the stigma and getting resources out there to help others throughout the state, not just in the National Guard, but across the state in suicide prevention. So I think it just speaks volumes about our people. But for you, what's been the highlight as you've looked at all these videos and thought about the Because We Care campaign?
What I really liked, sir, was that to see the commitment and the compassion and the empathy that our staff members that are running these programs have. They are just committed to what they're doing. They're committed to helping our service members and our families. And they just show that, and you can just see the compassion in the videos when they're talking. And what I really like is that, this is a tool that our service members and family members can go back and watch again and again. So if there is a time when somebody needs one of those services, they can go back and review one of those videos and contact, that office or individual to get the assistance that they need.
No, and I agree, and can't thank enough the program managers that run these various programs for us, whether it's sexual assault response, suicide prevention, ND cares, our outreach workers, our behavioral health and social workers, but they all are truly making a difference. But it takes more than that. It takes leadership. It takes leadership at every level. And like I do over the last several years, the number of times that we've had frontline leaders step in and just ask, how are you doing? And when somebody's having a bad day, ensuring that they get the help they need with the resources we have here or outside the National Guard, but just to keep fighting for that soldier or that airman, or even if it's a civilian outside the organization, to make sure they get the services they need.
I agree, sir. And when I look at it and I look at the family and that, we are truly a National Guard family. Our leaders are committed down to the lowest levels and understand, when something isn't right with one of their service members, and can identify that and have the strength and courage to come forward and let's go get the help that somebody needs. And it's okay. And when we look back at 2020, this has been an unprecedented, stressful year on many, many different levels outside of just the COVID aspects of it. And so to have that National Guard family that to rely back on and to know what resources are available are just so important.
I totally agree, and our citizens in North Dakota rely on us. As you know, this is the #1 domestic response the National Guard has ever participated in the state of North Dakota. But we can't help others if we don't help ourselves first. So individual service members, when you're struggling, really need them to reach out, ask for the help they need. We'll make sure they get it. And those that don't reach out, again, back to leadership at all levels of the organization. Frontline leaders, wingmen, battle buddies, just reaching out, following the ACE protocols, but asking how they're doing. Caring enough that if they are struggling, to make sure that you pull that, tease that out of them, and then escort them to get them the help they need. And I've said for years, there's a lot of stigma involved here. We need to remove that. But If your battle buddy was injured on the battlefield, you wouldn't walk away because you're not a trained medic. You would do everything you could to make sure that individual got the care to the best of your ability that they needed. And the same needs to go with suicide prevention. Is if there is one of our members that is struggling, we got to do everything we can to ask them. It's a hard conversation to have, but have the conversation. Care enough to get them to someone that can help them out. And like I said, I've seen that with our leadership at all levels for the last several years, numerous examples. I can't thank the team enough, whether again it's our program managers, leadership at all levels, but it really boils down to that individual soldier and airman treating one another like they would want to be treated, treating one another like family.